A very warm welcome back. Thanks for staying with us. Lots more still to come on our programme this morning with the cost of living crisis worsening. We'll be sharing some top tips for making the most of your cash over the next few days of the bank holiday. That's at around 6:45.
Yeah, and as holidaymakers battle the ongoing travel chaos, we'll be asking the expert, Simon Calder, what his advice is when it comes to avoiding queues, delays and lost luggage at the airports. That's affecting a lot of you, we know.
Yeah, and as always, do get in touch with us. Email us or tweet us. The usual ways, gbviews@gbnews.uk or tweet us at GBNews.
It is 6:25. Scientists have warned that post-coronavirus, the next pandemic could be even deadlier and sooner than we expect. So, with monkeypox hitting 190 cases across the UK and so-called tomato flu emerging in India, how concerned should we be?
Well, Professor David Denning of Infectious Diseases and Global Health at Manchester University and David Allmond, the CEO of the biotechnology company Novacyt, join us in the studio this morning to discuss infectious disease threats that we can expect in the future. Very good morning to both of you.
Good morning.
Professor, if I might start with you then. A lot of people will be thinking, I'm not ready to talk about another pandemic, and many corners of the world still dealing with this in a much more serious way than we are here. But I suppose lessons will have to have been learned from how prepared we were for the most recent pandemic. And do you think we would be prepared for a future pandemic if one was to hit?
We're much better prepared than we were before. I think there's much greater awareness amongst public health authorities, amongst virology, microbiology laboratories about emerging threats, and the international system for addressing them is also much better than it was before. We do need, when you have a new threat, setting up and scaling up testing is a big deal. And that's probably one of the major challenges going forward.
OK, and I want to bring in David Allmond at this point when we're talking about testing, because you have just lived through that whole experience, as we all have, but from the testing side with COVID, been very successful at producing tests for that. And I suppose, that could be a challenge for you again in the future. I mean, what preparations are you doing? Are there other viruses out there on your radar that you're worrying about?
Yeah, so what we do, in the pandemic, we were one of the first companies to have a test out, across Europe. And we have a very proactive surveillance looking for what's coming as best we can. So in the past, we've responded to Zika or Ebola, we've responded to swine flu, and now we're working on some future testing for monkeypox and adenovirus, which you also may have seen. So we're always, watching out, and then we can move pretty fast, actually, to develop necessary tests.
And you just mentioned monkeypox there, working on a test at the moment. I mean, how close is that to being ready and being used, and
that's
how widely can that be disseminated?
Yeah, so according to the need of the clinical community, we would have something, certainly in a research setting, that could be used within weeks to do that testing and monitoring. And, if we had to take that further because it became a bigger issue, then we would make it a clinical approved product.
So how do people test for monkeypox at the moment?
So the testing at the moment would be done through a blood sample or a skin sample from the pustules that occur in the disease. And then it could be a highly sensitive molecular test that we've all seen, PCR. And that would then, be able to pick up the virus versus other viruses it could be. In a relatively short space of time to determine whether someone should actually make a decision to stay at home and be isolated.
OK.
Yeah, David Denning, we're worried about monkeypox, right? And that's getting a lot of publicity, but and I suppose you'd say we're right to be concerned, but is that the biggest worry for you when you talk about emerging infectious diseases?
I think monkeypox may well keep going. It's got a longish incubation period like chickenpox, so it's going to be slower burn than COVID with a much shorter incubation period. But we still have to worry about influenza or flu. I mean, that clearly could be a devastating pandemic, as we saw the Spanish flu in 1919 and 1957, another episode. But there are other viruses that appear with no immunity because there's no residual immunity, and so you can get spread as a result of development of other viruses, and we saw that with the coronavirus, obviously.
Yeah, are we seeing a rise in the emergence of these kind of infectious diseases?
We're seeing more travel and more transmission across the world. We're seeing more rapid identification of unusual things. A genuinely new virus is quite difficult to identify because you don't have any of the molecular sequence because nobody's ever seen it before.
Yeah.
So that always takes a bit longer. And that wasn't helped by the way that the coronavirus appeared out of China in the beginning of that episode. It took a little longer than it should have done, actually, to nail that. And then you have the other problem of mutants and variants appearing very rapidly, as we saw with coronavirus. And that can also make the testing a little bit more complicated. And it's one of the things that Novacyt is specialised in, is tracking variants to keep up to date with all of those.
And obviously those variants emerge because people are travelling so much and there's a lot more of a chance to intermingle.
And there are billions of viruses in somebody who's infected. And so it's not... And if you and I both had a slightly different variant of coronavirus, they may mix and produce a new variant again. So when you have a lot of people infected and lots of virus, variants do emerge.
And Professor Denning, look, you talked about Spanish flu. We were all sort of got lulled into this sense of security that these sorts of pandemics are sort of every 100 years or so.
Yes.
Could another one come sooner than that?
Absolutely, yes. It's very unpredictable, and one wouldn't want to predict that you've clearly got, with all the buses coming together, as we often see in transport terms. But yes, and having had the social isolation and people wearing masks for the last 2 years with the pandemic, so people have not been exposed to lots of other viruses, and so the immunity has waned a little bit to those viruses which normally circulate. And they may just be, bad colds, or they could be very serious, and all of those things are possible.
Yeah, but just to finally just finish for us on a word of kind of optimism, and let's get some perspective. Let's not get carried away with this, as often a lot of the media does.
We are much better prepared to be able to address these things. Most viruses don't cause life-threatening infections. They cause, they're ill with them, but they don't kill people very often. In the context of monkeypox, those who've had smallpox vaccine, which are most of the older population, probably a much lower risk of getting the disease, actually. So there are some other reasons why certainly monkeypox isn't going to probably be a devastating infection like COVID.
Great notes to end on. Professor David Denning and David Allmond, thank you both very much for coming in this morning. We have to put our faith in the scientists to try and solve any future problems that might be coming our way. Thank you so much.
Thank you.
Do stay with us. We're going to be going through your papers this morning today, joined by David Mellor and Claire Moss.
Another David.
Always interesting. Yeah, another David.
Another David. Everyone's called David.
We've got 2 Pauls later on in the show as well. Just keeping it simple for me. First day back after the holiday. See you in a moment.